Today's weather is so beautiful, isn't it? But unfortunately, some people will not be able to experience it. Do we, the fortunate ones, ever think about the problems of the blind people? According to World Health Organization, it is estimated that approximately 1.3 billion people live with some form of vision impairment, and from that, 30 million people are blind. 90% of visually impaired people live in low and middle income countries. Out of all blind people, 82% are over the age of 50 years. With increasing age comes the diseases, and with diseases comes the medicines, lots of medicines. And for taking medicine, blind people require assistance. But getting help always is not possible in this busy world. Due to improvement in technology, blind people have started relying on their own, but taking their medications on their own, not yet. Sometimes, even we get confused when to take which medicine. Also, most of the medicines look alike. Now think about the blind people. The health sector have thought about it. There are few devices available for easy recognition of various medicines and their dosage regime. But these devices are very costly and are also not available in India. Is there any other method used in India to help blind people recognize which medicine is it and when it is to be taken? To find it out, we surveyed a few pharmacy stores in Baroda to know whether they are using any specific system. But we found nothing. So what can we do now?
Being a pharmacist, it is our duty to fulfill the prescription needs of patients. Realizing that this was a major problem among the blind, we thought of an idea to solve it. Blind cannot see, but they can feel touch, right? For this idea, we will need bindis. Let's see how. Suppose this is our strip pack of medicines. We will utilize its top right corner to stick bindis. That is, to represent our dosage timings. Each bindi represents one dose. Mostly, medicines are prescribed in morning, afternoon and evening. The shape of bindi suggests if it is to be taken before or after meal. C represents before meal and D represents after meal. If no tablet is to be taken, then it is represented by a small bindi. If one tablet is to be taken thrice a day before meals, then it is represented by 3 C's. If one tablet is to be taken thrice a day after meals, then it is represented by 3 D's. If one tablet is to be taken twice a day after meals, then it is represented by D.D. These are some other examples represented in the same way. Here are some practical examples. Wait, but why this method? Bindis are easily available everywhere and moreover they cost very less. Unlike other devices, no manufacturing unit is required. Blind people, people with other vision impairments, old patients, patients suffering from dementia, deaf people, etc. can also benefit from this method. This method can also be utilized for explaining dose regime to illiterate people. Bindis can be used for many formulations like syrup bottles, blister packs, boxes, wrappers, etc. This is a very simple yet useful innovation. Think about how useful it will be for the blind. Pharmacy stores can easily implement this method.
Every problem has a solution. A little creativity can help to find it out. So this was our idea for Incri Pharma. I am Shweta Shah
and I am Janvi Soni.
Thank you.